So, this is the end of the resurfacing procedure and remodeling procedure for skin resurfacing for acne scars. And we perform several passes, and this is the typical end result after at the end of the procedure. The skin has been micro-perforated with the erbium YAG laser. You have a pinpoint bleeding. So at this time, one of the most frequent questions that I've been asked is, what do you do next? At that time, we cover the area with the normal saline wet compressors and ice packs in order to make the patient more comfortable. And then at the end of this, we're going to use an innovative combination of ultra-micronized hyaluronic acid mixing with a combination of anti-inflammatory principles. This is prepared extempore just before the application, and it's going to be delivered to the skin. And the skin in this case, in this kind of stage, is like a sponge. It's going to be absorbing everything inside very fast. On top of this, we put a sterile silicone semi-permeable gel. So this is the innovation we have here, which is complete sterile. So we have one of the two components is a micronized sterile hyaluronic acid, and the other syringe contain the anti-inflammatory, principles, and you mix it extempore just before the application. Okay, this is the box, and it comes with the two syringes, and this is absolutely sterile. Now I changed my gloves because I touched the box. May I have two gloves, please? So if you want to be absolutely sterile, the nurse is going to open, the package and free the syringes on a sterile, field, and then you can work in a sterile environment. Perfect. This is the active ingredient, the anti-inflammatory, this one. Micronized hyaluronic acid and the connectors. Everything sterile. Yes. Open one. We open the second one. Use the connector. One connector. The other connector. And then we mix. We make, the active ingredient penetrate the syringe with the hyaluronic acid. And then we do up and down in order to mix everything together. 4 or 5 times is more than enough. You don't need to exert much of a pressure. And this kind of, let's say, solution is extempore. So you can mix anything with this because we are going to use it immediately on the patient. We don't have any sedimentation, no separation. This is just a mechanical mixing. Good. Now everything is in the same syringe. This is a small spatula. Okay, done. And then I'm going to use it. Yes, please. Very good. You can touch also if you want, but in this case I prefer not to. And then I use my gloves. Yes. You see, the patient is very comfortable. It's not burning. So you distribute everywhere this micronized form of hyaluronic acid with the active ingredient. And as I said before, the skin at this stage is like a sponge. It's absorbing everything. Okay? We allow 1 minute for the absorption, and then we put a silicone gel on top to seal everything.